So our next question was if female patient with history of arthritis presented to ophthalmologist with the complaint of sudden painless loss of vision. She had undergone cataract surgery for the same eye 1 year back. The fluorescein angiography picture as seen in the figure is given and they have asked for the differential diagnosis in this patient. Now, how to crack these type of questions? So first of all, what is this picture? Okay, you have to see this picture. So how to identify? First of all, you should know that what is this investigation. This is a fluorescein angiography picture. Okay, why it is a fluorescein angiography? You are seeing a black background. Here you are seeing this is the optic nerve head and these are the blood vessels. Okay, and this is the macula. You have the central zone and some fluffy type of leakage, okay, near the macula. So what is this? This is basically a cystoid macular edema. Now the cystoid macular edema with flower petal appearance. Okay, this is called flower petal appearance of the cystoid macular edema. Now some students are saying that sir, it was not a definitely like this figure, it was a central, definitely a black center, but the whitish zone was much lesser. They are saying that whitish zone was like this only. It is not a complete a flower petal appearance. So what happens, friends, that sometimes this leakage is in the end where we have many phases of the fluorescein angiography. We have early phase and the late phase. So sometimes this picture comes in the end only. But this type of leakage starts from the early phase also. So don't get confused that if this was the fundus picture, you don't have to mark chloroquine toxicity in that. Why? Because let's say now what the question asks. So question asks, there is a female patient, history of arthritis. Some students are saying that it was a rheumatoid arthritis, but definitely it was an arthritis and there was a sudden painless loss of vision. Remember, in the chloroquine toxicity, you won't get a sudden loss of vision. Next, an important risk factor for the cystoid macular edema, they have told that the patient had earlier undergone cataract surgery. So cataract surgery itself is a very big risk factor for a cystoid macular edema. So you have two risk factors, one is a arthritis and one is a cataract surgery here. So answer here definitely is cystoid macular edema. Don't confuse it with chloroquine toxicity. Now how this type of picture shows in the your OCT, basically when you do an OCT you find cystoid spaces in the macula. Okay, you get this type of cystoid spaces in macula. Okay, so these are the important things that you should remember in case of cystoid macular edema. Now sometimes you have to remember that what are the important risk factors for cystoid macular edema. So the things that you should remember is the important risk factors are diabetes, intraocular surgery, as you can see autoimmune diseases, then use of epinephrine, sometimes the PG analogs that we use in our glaucoma subspecialty that can also cause a cystoid macular edema, uveitis, retinitis pigmentosa and vein occlusions like BRVO, CRVO. So these are the important risk factors for macular edema. Now, how should you treat it? So the important treatment modalities are, most of the times in the if the macular edema has come in the post-op period, it can resolve directly, or we have to just use wait and watch strategy. You have to counsel the patient that it would go with its own, but if it is not going, then you can use topical NSAIDs like ketorolac, or you can use intravitreal anti-VEGF or steroids. Now these steroids can be dexamethasone implant or a triamcinolone implant, or you can do a macular grid photocoagulation. Okay. Sometimes there is a vitreomacular traction also. In that cases, you have to do a vitrectomy. Okay. Thank you. So our next question was that a 55-year-old male came with the chief complaints of glare when driving in the night. What is the probable diagnosis? So options were age-related macular degeneration, posterior subcapsular cataract, cystoid macular edema, and corneal degeneration. According to me, the answer here should be posterior subcapsular cataract. Okay. Now this is a figure of posterior subcapsular cataract. Can you see the opacity here? So this is basically a slit lamp examination that we are doing, and in our slit lamp examination what we find is that, let's say this is the lens. Okay, this is a crystalline lens, this is the anterior capsule, and this is a posterior capsule. So what we find is that the opacity is in the posterior subcortical region. So just beneath the posterior capsule we have opacity. Okay, can you see here this opacity? This is in the posterior subcapsular region. So we call it posterior subcapsular cataract. Now what are the most important features of posterior subcapsular cataract? Remember that this type of cataract is more common in young patients. Okay. Also, it is very important to note that in these type of patients, the opacities are near the visual axis. Okay. So if I draw a visual axis, when we told you about the angle kappa and angle beta and angle gamma, so there was a visual axis now. So all the opacities are near the visual axis. So the destruction of the vision or the disturbance is more. So the patient comes with the chief complaint of glare. Whenever he drives, the patient says, okay, I am okay in the night, but whenever I drive and I find a headlight coming in front of me, I find a lot of glare. So this is the main complaint of a patient with the posterior subcapsular opacity. Also, whenever there is a glare, you know that in the light there is a pupillary constriction. Okay. So what happens is that whenever there is a constriction, let's say now the light is coming from this zone only, there would be a lot of difference. So in bright light, patient feels lot of discomfort. Another important point here is that, as you know that during a near vision there is also constriction. So in these type of patients, the vision is down when patient reads. Okay, so during near vision it is much worse. So I would say near vision is less than far vision in posterior subcapsular cataract. Now I basically see the other options also. In ARMD, the chief complaint is metamorphosia. What is metamorphosia? Let's say if there is a straight line, the patient sees the line like this. So there is change in shape. Okay. In cystoid macular edema, there is a blurring of vision. Now this blurring of vision has no relation whatsoever to the light. Okay, so even when the patient is in patient is in bright light or dim light, he feels that the central object has blurring. Now our next option was corneal degeneration. Now what are corneal degenerations? The basic important corneal degenerations that you should remember is arcus senilis. Okay, so let's say this is the cornea, you would get a arcus beneath it. So normally the degenerations, the corneal degenerations, they don't involve visual axis. So unless it is very high, they don't disturb the vision. So answer here, according to me, is age-related macular, sorry, posterior subcapsular cataract. Okay.